Welcome to the Reimagine Patient Engagement Podcast. This podcast aims to answer the changing dynamics in patient engagement. What role does technology play in the space, and what are the key initiatives and metrics each individual in the ecosystem expects? Let's get started.
Welcome to Reimagine Health. My name is Donna Rice, host of this podcast series. Today, we are thrilled to have Dr. Palak J join us. Dr. J is the Chief Population Health Officer at AccessHealth Community Health Center in Houston, Texas. She is passionate about healthcare transformation and impacting the social determinants of health in communities of color. She is an expert in healthcare strategy and operations with 8 years of experience creating and scaling health solutions for underserved populations around the globe. Please help me welcome Dr. Jalen. Dr. Jalen, you have an extremely interesting background. Can you share with the audience your background and how you decided to segue into population health?
Thank you. I'm honored to be here on this podcast with you, Donna. I think my journey was a little bit non-traditional. I was training to be a dentist in dental school, and it was all going great, but somehow I felt that, direct clinical care was not for me. So even after graduating and working as a dentist, I spent a lot more time in those couple of years at a nonprofit working in healthcare management, public health, and population health. And that was what led to my passion overall in population health and well-being. I decided, I want to move away from clinical practice to more community-focused outcomes and the power of plurality is what I was going for. So I think that's what led me to population health. And then in my current role, so many populations and communities that we're able to address in risks and overall health and well-being. So that keeps me excited and keeps me going.
Yeah, I love the fact, too, that you're a dentist because I think, dental care in high-risk communities, it's just not happening. And I think there's so much, with your background that you could really impact. So I think you've got an awesome background to be working in population health. So currently you work in a federally qualified health center. And can you share how Access Health is impacting care in high-risk communities and how they're really executing when we think about value-based care?
Sure. You're absolutely right. Oral health is a part of overall health, and sometimes that gets missed out when we think of populations and neglected. And it also provides a good window, to say so, into overall health and well-being. Access Health, being a federally qualified health system, has 5 clinics and 11 big sites. We've been in the communities for 40, 50 plus years and provide care to communities, whether they have the means or they don't have the means. And most times when that happens, we end up seeing a disproportionate amount of folks that don't have the means to usually afford care or insurance and have other things impacting them. So when we think of population health, of course, we think in the scientific terms of, who are our high risk patients, who are visiting ERs more often, who have multiple hospital visits. But we're looking at a holistic picture of, those needs, behavioral health needs, but also and largely social needs. How is food, housing, transportation, medical, legal needs impacting their health and well-being, and how can we address that? So our focus is like integrated and holistic in nature, and we address that through a variety of programs.
Great. And so looking at value-based care, how does it fit in, and how are you really executing on value-based care within this federally qualified health center?
When we think about value-based care within a federally qualified health center, a lot of the payer mix distribution sometimes is largely Medicaid, and there's a split between that and uninsured population. And Texas being a state where we did not expand Medicaid yet, we have a much larger adult population that's uninsured. So when we think of value-based care, we're usually thinking of, folks that are insured, Medicaid or Medicare. And then our focus is how do we risk stratify those folks? What is the data that we have on those patients, and based on that, providing them the best quality care and meeting certain quality measures. They are quality measures, but eventually they're like overall health and well-being measures that we make sure that they have their annual well visits, that they have the chronic disease management piece, and then, as I mentioned, the social care piece addressed as well. So that's the lens that we take on value-based care.
Right. So really reaching individuals and really impacting their health is a kind of ongoing process. And we know that, and it doesn't happen overnight, and it's often a challenge. So what strategies have you used to improve engagement and outcomes in these underserved communities?
Yeah, that's a wonderful question. There is a digital divide, and everybody has, if you look at census data for smartphones or a good understanding of how many people are using internet to access social media or other things, it's a lot higher. But having the understanding or the time frame to engage in health and well-being usually comes with, oh, I need a job and I need to pay for this, or oh, my child needs this. So most times people are putting their health and well-being much further behind. So our strategy of engagement technically is multifold. A lot of it is, community health worker based, word of mouth, and engagement peer to peer, because that shows up as very strongly in underserved communities. But we're also leveraging digital technology in a way that we're able to connect and communicate with a variety of patients. So whether that's automated like texting or messaging about the needs, conscious use of social media practices, or our technological tools and platforms that are able to connect patients to resources. We're using all of the above to engage our patient communities.
Yeah, I love that approach too, because I think from my experience, I find that it's not one size fits all. You need different strategies for different populations. And, like you said, the digital divide still exists, but there are some people that, respond really well to text, some really well to phone calls, and some with that community health worker, that more one-on-one kind of closer interaction. So I think that the challenge really comes as how does the center really provide all these services and really kind of get the outcomes that they're looking for. So looking at that and the vast amount of work that has to be done, what do you think is really missing? Like what could really be like a game changer working in these high risk communities? Any thoughts?
Lots of
Good question.
thoughts. And that's I mean, it's like asking, what do you have on your Christmas wish list, right? And I can give you a long list of
I
things.
love
But
it. Mhm.
but a lot has to do with, for example, we spoke about digital tech. Um, what is there in people's hand is one thing, but having the broadband access and availability and knowledge about that piece is also equally important. So there is the infrastructure and policy piece, but then there's also the community engagement and information piece. So I think the stronger peer networks we have, the stronger the engagement of communities will be. But that digital literacy piece or that engagement piece needs to be addressed with more like behavioral interventions versus, like waiting for a generation to change and everybody having that capacity or capability. So I think in terms of the policy landscape, we can do a lot more to bridge the digital divide. However, there is so much happening. For example, like the government's Get Internet program that is out there, but folks don't know about it. And then if they know about it, they're not confident about like how to sign up for it. And if you and I were able to get on that website, we may think, oh, it's such a simple process. But I still think, that hand holding may be needed for a certain age group or digital literacy gap. And that can be addressed through both policy and technology and teaching.
Yeah, I agree. I think that's really, really important. And so many times I know even from my experience that hand holding is so important. Just helping them through it. Once you get to that first step, then the second step comes a lot easier. And it's just baby steps and working in communities and working with people. Sometimes you just have to take those baby steps. But I agree. I think there's a lot that can be done with policy change. I think COVID really opened the door to really exploding kind of the need for free internet or low-cost internet services as well. So I think that there's a lot of opportunities still to come in these communities. So about metrics and outcomes, how do you measure success outside the usual process measures?
Oh, that is such a wonderful question. There are so many quantitative measures. We have HEDIS, some systems have MIPS and MACRA. We also have UDS, ECQS. So there is no dearth of measures, but the other piece truly is qualitative in nature. And those are like whether you get it through patient satisfaction or experience surveys and get that qualitative input. The other thing is, hearing those patient stories and testimonials on what is improving their health and well-being. So if you hear, and that's something we get from the staff, and that improves staff engagement as well. So us knowing that, through a fruit and vegetable prescription program, food insecurity is addressed, and the patients don't have to make a choice between um, food and medicine, that's a successful measure and metric for the numbers that we're able to address. But if somebody shares that the help and support that's given has improved their patient experience, yes, but overall health and well-being, then it helps even further move that process forward. So I would say, data is wonderful, but data is only a piece of the puzzle or story. What requires data is the story around data, and that comes from patient experience and then testimonials as well.
And are you collecting testimonials? And is that something that you like put on the website? Is that something that you kind of judge the quality, kind of like a press ganey for your clinic?
Yeah, we do have like patient experience surveys that we do, and that is standard in measure to understand where we're doing good, where there are some needs and growth for improvement. So we do have something like that, but constantly, like our care coordination team and staff is always talking to patients about their experience, even during points of check-in. So those personal calls beyond the text messages and the surveys also give us that feedback. And while the patient is there in person, it's how they feel in that moment. And if it's good, they really share it with them. So yes, on our website, through our like program listings, through different ways, we definitely share those patient testimonials.
Right. So you collect outcomes related to kind of behavior change as well, and then certainly engagement, and then actually kind of their personal experience, kind of outside
Right.
of process measures. Is there any other outcomes that you could think of that our viewers would be interested in from a population health perspective?
Sure. So, I mean, we do track social needs being met, right? So, if I talk to you about like food insecurity, transportation needs, what's been the major reason to miss appointments, all of that data beyond, the healthcare prescribed outcome data. And I'm not talking about those prescribed data sets since they're pretty consistent across the industry. But internally, we do track these loops being closed for social needs and for other domains that we want to do quality improvement in. And so we would regularly see, okay, what are folks saying about their food needs being met? Or is food insecurity for our population lower in the last 1 year because of the interventions that we've done? And I talk about food. Food is not the only need, but it's probably, a more sustainable need to be able to met with the infrastructure that's out there. But if you talk about housing, we don't have outcome measures associated with that. But what we do have is then the availability of a data set to again look at policy and say, this is a huge gap or need, and how can we address this from the lens of population health and value-based care? Because value will only come from better outcomes, and better outcomes mean better overall health and well-being.
Absolutely. I think it's, I mean, when you think in terms of outcomes, you really need to have that engagement, and you need to have people come back, right? So you have
Right.
to keep that ball rolling to really see any kind of long-term outcomes in those communities. And oftentimes they're difficult to reach. Their phone numbers may change. They might not have a phone. They move from place to place, even within those communities. So sometimes it is a total challenge. So, Dr. Joanne, when we talk a little bit about, the digital divide, and we mentioned it, and we're saying that, it's existing today, in some ways, shape, or form. But what is it like for you, and how do you see the integration of technology in the future for these populations?
Oh my God, you're again, like Donna, you're throwing so many curveballs. But um, this is again, you know, we like it, we love it, we hate it. Technology is the present and the future.
Uh-huh.
So engagement associated with technology, I personally believe, is going to be key if we want to look at healthcare improvement and then overall like health behavior improvement. So to me, I mean, when we look at like GPT-3, GPT-4 coming up, a lot of these like intuitive technologies that can be more conversational in nature, there is a way to leverage that in healthcare internally and be able to create those actionable tools that sometimes is not possible to do face to face. So face to face has its place, and I don't think will ever be replicated or replaced. But what it does help is, at our own time, at our own convenience, being able to lead through the process. So whether that's medication adherence or like, understanding that, or it's around um, needs in that area and being able to like geographically tag and see where you are associated with those needs and what's closest to you, and then navigating and closing those loops. I think technology will play a huge role. And coming to behavior change, it's again something that, um, if you think about behavioral economics or the theory of behavior change, we are already seeing technology being used for sometimes not so healthy behaviors.
Mhm.
But if the same nudges were used for health behavior, or the same like gamification was used to incentivize healthy behaviors, then I think, it has a key with the health insurance market as they're already exploring it. It has a key with the provider market, of course. And that's why, you see folks in health tech or primary care all coming together to leverage technology. So I totally think it's the future, and I think it's a very exciting space. But being able to use it ethically well and to do good is going to be the next steps.
Exactly. Your answer was perfect. I loved it. And I think really when we think about, gamification, I know it's working really well in diabetes, especially with young children. So I think looking at different populations and the needs of different populations, I think there's just so much opportunity with technology. And I'm really excited about it. Just thinking about the care for, people with diabetes or with chronic illness and how it could really impact. And just AI having those conversations and having somebody stay close to them, I think it's going to just be really valuable in the future. So I agree with you. I think the future is really bright. And I think just the applications of different technologies and then using them in the right way, I think is going to be most important. I just want to say thank you, Dr. Jalan. It's been wonderful interviewing you and talking about population health. Is there any last minute thoughts that you'd like to kind of share with our audience before we close?
I think if the audience is in healthcare or, in some space, it's a very exciting time to be in healthcare. So I would say, all thoughts, all views, all different ways of doing things are very, very important because um, there is a lot that we need to solve, but there are even more tools to be able to solve. So I think as the audience listens to this, I hope they explore their own tools and expertise to solve some of the main needs that we have in healthcare right now. And such a pleasure talking to you, Donna. It was amazing.
Thank you. Thank you so much for joining us today. I think you're doing some amazing work, and we really appreciate you taking the time to join us on Reimagine Health. So have a nice day.
Thank you. You too.
The bigger vision of Reimagine Patient Engagement is to build a community of healthcare transformers working to improve patient outcomes. Patient engagement requires patients to be in the circle of care to ensure their care is holistic and not as a snapshot during a moment of crisis, but as a view that is ongoing, continuously enriched and deepening over an entire lifetime. So, to be part of this amazing community and contribute to the vision, reach out to us at www.connectedcarecircle.org. That's www.connectedcarecircle.org.